Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information. This is Dr. Pat. I'm here with Brigid, and today it's bleeding in early pregnancy. Bleeding and spotting in early pregnancy can be really frightening. We've got our own experience of Brigid having a big bleed when she was 7 weeks pregnant, and it came as such a shock. And I remember feeling anxious and thinking we'd lost the baby, and even with my expert knowledge, being really scared. This episode is about giving you the knowledge so you know what to ignore and what to have investigated, and to help give you that sense of calm as you try and navigate the waters of early pregnancy.
So, Dr. Pat, this week, have you got any little tidbits for us?
Some more good news this week. 2 of my patients who've been having ovulation induction got pregnant this week.
Oh, that's very exciting.
That's great. So these are both women with polycystic ovarian syndrome who have needed some medication to help them get pregnant. And as we've covered in a previous podcast, it can be tricky to get the dose right. We want enough to get pregnant and not enough to have twins. That's the ideal amount of ovulation induction medication to give. Twin pregnancies can be very happy and very normal, but they can also be a little complex. And the right way to go with ovulation induction is to try and get people pregnant one baby at a time. So we've nailed that twice this week. I'm pretty happy about that.
That's good. And coincidentally, these women don't know each other, do they?
No.
No. But in the waiting room, have they sort of keep going, how you going?
Yeah, I don't know what people talk about in the waiting room. I'm never in there. But I do know, I guess the pregnant women who can tell that the other woman's pregnant would always say hello and ask where you're up to. I don't know. Maybe, I don't know what the gynae patients talk about or the people who aren't pregnant yet talk about them. I'm never out there.
Yeah. Okay, so all of you who are listening and you're wondering about ovulation, I would suggest you pop back to episode 2 where we talk about what is ovulation and what is ovulation induction. Anyway, so here we are. We are talking about bleeding in early pregnancy, which is a really anxious time when you have a spot or you might have a bright red bleed or, there's so many variations that you get. There's a lot of discharge, isn't there, when you're in early pregnancy?
Sure.
So, Patty, I'm going to talk about what a woman might experience. Her period's late. She's had her pee on a stick and it's come back positive, but she's got some spotting. What's going on there?
So that's a really common situation that we see at work a lot, and it's an anxious time for the couple because one of the possibilities is early miscarriage, and that's where our mind goes to first. Thankfully, most of the time when there's bleeding in early pregnancy, it's not a miscarriage actually, but we need to keep an eye on that situation until we can reliably reassure that woman that things are fine. So some of the possibilities are that it's something called an implantation bleed, which is, remember, the egg comes out of the ovary, it's picked up by the trumpet end of the fallopian tube, and about halfway down the tube it meets up with the sperm coming up the other way. Fertilization, where the sperm penetrates the egg, happens in the tube, and then the tube will push the fertilized egg down back into the body of the uterus where it implants, and all of that takes time. So somewhere around that sort of 4 to 5 week mark in early pregnancy, 4 to 5 weeks into the last period, the fertilized egg is literally implanting into the lining of the uterus, which has got all thick to be ready to receive it. And that process can cause bleeding, and sometimes that's all the bleeding is.
And what we get a bit obsessed with the type of bleeding. So what sort of, is that just like brown spotting, or is it like bright red, or what should a woman expect from implantation bleeding?
That's usually pink spotting.
Pink.
Yeah. But any bleeding needs some attention because we just don't know whether it's a miscarriage or an implantation bleed or nothing or whatever. So the appropriate things to do is to catch up with your local doc, or you might be seen in a hospital emergency department after hours, and they'll check you over and make sure that you're basically well, and then it's to work out what's going on with the pregnancy. And of course the appropriate test is ultrasound. If the ultrasound shows a pregnancy that's in the uterus with the heart beating, tick. Regardless of the cause of the bleed, we know things are fine.
Yeah.
And if it shows an empty uterus, or if the woman's very unwell with pain, or a dozen different possible scenarios, then each of those has got their appropriate further testing and investigation.
Yeah. I love that image that you've just put in my mind of the egg, on its journey down the fallopian tube and, everything being pulsed towards to meet the sperm. And, even the image of the fertilised egg sort of burrowing in to the uterus lining, like that it's just such beautiful imagery.
It's a beautiful thought, isn't it? Yeah.
And sometimes, though, it doesn't quite go to plan, does it? And the fertilised egg might just hang around too long in the fallopian tube.
And try and implant in
the
fallopian tube. And that's an ectopic pregnancy. And that's one of the things that needs to be seriously considered when there's bleeding in early pregnancy. So with a combination of ultrasounds and some quantitative beta HCG levels, the one that gives the number, the blood test, we can work it out.
So the blood test will tell us whether it's an ectopic, will it?
Not all by itself.
Yeah.
But it's about building a picture where we say, okay, what can we see on ultrasound? What's the blood test telling us? And there's almost a flow chart that helps you work the answer out.
Yeah. And if we're investigating an ectopic pregnancy, is there a prime time for an ectopic?
Well, an ectopic pregnancy will usually only come to light when it either bursts out of the tube, it's implanted in the tube and it's got too big and it bursts out, and that might happen at 7, 8 or 9 weeks of pregnancy, or when it's trying to implant somewhere where it shouldn't implant, it causes bleeding, and the bleeding tracks down through the cavity and out the vagina. And
that could be at, 6 or 7 weeks.
Yes, exactly.
Like
and that might happen so early, even before the ectopic pregnancy has got an obvious appearance on ultrasound.
Dreaming of treating yourself with new bed linen as we head into winter? Let us make your dreams come true. Right now, when you sign up to become a Mamamia subscriber, you'll go into the draw to win $2,000 at Bed Threads. Beautiful French flax linen, organic cotton sheets and towels to match. Yum. For as little as $7.41 a month, as a subscriber to Mamamia, you'll get access to every article, every podcast, and every single video we make. Plus, access to Move, our at-home fitness app. And you're supporting independent women's media, and for that, we thank you. Subscribe today for your chance to win your dream bed combo and accessories, with thanks to Bed Threads. Click the link in the show notes and subscribe to Mamamia today for your chance to win. Entries close April 30, T's and C's apply.
Okay, so if you have had a suspected ectopic pregnancy, how is that treated?
Well, briefly, if an ectopic pregnancy has been proven, there are a couple of different types. There might be a pregnancy that's sitting in the fallopian tube and it's known to be there through the testing, but it hasn't burst out the tube. And they can often be treated. Sometimes they will miscarry by themselves, and sometimes that's a process that just needs to be observed and the blood hormone levels followed back to zero. They can be treated with medication these days, a medication that works a little bit like chemotherapy and goes in there and dissolves the cells, and that can avoid an operation in some situations. But if the ectopic pregnancy has burst out of the tube and it's bleeding and the woman is very unwell, then obviously that needs to be treated with an emergency keyhole operation to go in through the belly button and fix the bleeding and often remove the tube.
It's dreadful. We've had a very good friend who has had an ectopic pregnancy and she looked dreadful. It's obvious, isn't it, if you've got a burst.
Yeah, most people with a burst ectopic look very unwell.
Yeah.
Yeah, and that's a hospital emergency department type scenario.
Yeah, and over sort of what period of time, if you feel like symptoms are coming along, where are you feeling those symptoms?
Of
ectopic
of a ruptured ectopic?
Yeah.
Well, I think that needs to be considered by patients and by doctors of anyone who's known to be pregnant and has a bleeding and severe pelvic pain.
Okay. So it's not specifically one-sided or... No, it's just incredible pain.
So pain, bleeding and known to be pregnant.
Yeah.
Then we've got to look into that.
Yeah. So there's lots of reasons why somebody might bleed that doesn't lead to a miscarriage, but what are some of those reasons?
Well, in the early pregnancy, what's happening is that 1 million little blood vessels are connecting up between the pregnancy and the lining of the mother's uterus, and it's a miracle that doesn't bleed all the time. Okay, and it probably does bleed all the time, and we just don't see most of them. So a lot of that bleeding is harmless. And ultrasound can be used in that setting to show people that the pregnancy is carrying on fine, that the source of the bleeding can't be seen, there's not enough blood to show up on ultrasound, and that the baby is fine. And that's what usually happens if a woman presents to a hospital emergency department with bleeding in early pregnancy. And it's one of the reasons why we like to have a scanner in the department, so we can scan people on the spot and say, you're fine.
Yeah, go home.
Yeah.
Yep. I know this because, we're in the same household, but you do get some questions, some phone calls at different times of the day and night where someone's had a bright red bleed after sex.
Yep, so bleeding after sex in pregnancy worries people as well because they, again, think it's a miscarriage. It's usually not. It might be. So bleeding after sex in pregnancy needs an ultrasound to investigate, see how the pregnancy is going. And if everything's fine, then we usually advise those couples to steer clear of sex for a couple of weeks, wait for everything to settle down, and then reintroduce sex again and see how we go.
And, we do play the blame game a little bit. If by chance we do then go on and have a miscarriage, we look back on all those things that caused miscarriage. Do you think that sex does cause miscarriage?
No, I think that's very clear that it doesn't. We don't know what causes a lot of miscarriages, but we do know that it's usually got something to do with the sperm and the egg not coming together properly in the first place. So if we think about all the DNA from the sperm and all the DNA from the egg, they have to come together and be connected up like a giant zip. And as that zip goes up, mistakes can happen. The wrong bits of DNA hook up with the wrong bits of DNA, and we wind up with an early pregnancy that's capable of surviving until 5 or 6 or 7 weeks, but not beyond that. And that's the cause of most early pregnancy loss. And whilst it's very sad, there's nothing that can really be done to prevent those ones.
And I think that's a really important point to make, because a lot of women sort of blame themselves or their situation or their stress at work or whatever it might be.
Yep.
But actually, there's no control over how that DNA might zip up. That's a really good analogy. I like that idea.
That's right. And there is no control over that. And I think it's super important that people understand that miscarriage isn't their fault. I saw this beautiful thing in the internet somewhere once, just a woman holding up a sign that said, presumably to her caregivers, thank you for saying that the miscarriage wasn't my fault. And she just needed to be told that because we're human beings and we tend to blame ourselves for things.
And look for causes.
And look for causes, that's right. It can be very frustrating to people when a clear cause of their pregnancy loss isn't found. So then they start saying, well, it must have been something I did or didn't do.
That's right. And miscarriage is pretty common, isn't it?
Yeah, absolutely. So first trimester pregnancy loss is extremely common, and when I see people with a sad first trimester miscarriage, they will tell their family and friends, and at that point their family and friends will go, oh yeah, that happened to us as well, And thankfully, most people recover from it very well. And most people who were in good psychological health will accept that the pregnancy loss happened. They will feel very sad about it and a great sense of disappointment at the start. But that passes in as little as 2 weeks. And I see people 2 weeks later for that very reason, because I want to make sure that they're on the right track to emotional recovery. And people at 2 weeks are very different. Most people are improving day by day. They've been able to contextualise the early pregnancy loss as something that's very sad, but they're already hopeful for the future and almost ready to start trying again.
And I've heard you say it before, you've got a nice little phrase which is something like, you might always remember the loss.
Yeah.
What is that again?
Well, I just say to people that the pregnancy loss is something that will be with you forever. So if you're a grandma and your granddaughter has a miscarriage, you'll say to her, oh, I had a miscarriage too. So it will be with you your whole life, but it won't hurt.
Yeah.
For very long. People are extremely resilient.
Yeah. And those that perhaps do need help, like it will be a trigger where they need to sort of seek help from a psychologist or,
Yeah, so a certain number of people, it might be the mental health straw that it goes a bit too far. And of course, we're talking about people with isolated first trimester pregnancy loss. If you've got recurrent pregnancy loss. That's a different scenario, and it's very sad. It's difficult to treat. But when people have a first trimester miscarriage, most people think that they're going to be that person, that it's going to keep on happening, and perhaps they'll never have a baby. And of course, that's not true for most people. Most people get pregnant again a few months later and they're fine.
Yeah.
So if you've had about 3 miscarriages in a row, or you've got miscarriages that are suspicious, like they happen really late, then we have to start investigating those people and treating those people. But for most people, it doesn't need investigation or treatment. They're not recurrent miscarriers. It's an isolated thing.
It's Monday morning and your mind is already racing.
And you're replaying an awkward conversation you had during the week. Your inbox is full, your patience is gone, and life just feels like a lot.
I'm Ashani Dante, and alongside with clinical psychologist Dr. Anastasia Herodes, we're here to help you unpack the messy, honest stuff that keeps you up at night.
And this is But Are You Happy? The Mamma Mia podcast where we skip the fluff and dive into the real talk you actually need.
This is the mental health podcast you and all your friends need. Listen to But Are You Happy Now, wherever you get your podcasts.
All right, so someone's experienced a bleed in pregnancy. Every single bleed needs to be investigated. Is there anything that also happens once you have a bleed in terms of their blood grouping or...
Yeah, so blood group's relevant at this point. So that if a woman's a negative blood group and has some bleeds in pregnancy, then each one of those needs to be looked at. That's a part of an issue called rhesus disease, which we'll cover another day. But sometimes a bleed in pregnancy is of a sufficient volume that we need to treat the woman with some stuff called anti-D, which will neutralise any positive blood cells which might have escaped from a miscarriage into the mother's system.
I'm very familiar with having my anti-D shot. I'm a rhesus negative, so, many anti-D shots along the 16 years of having babies.
Yeah.
It sounds like I've got a lot, but there's only 4 in there.
4.
All right, so, Pat, a woman's had a bleed. What's the next step?
I think the next step is for her to be assessed by her doctor, for an ultrasound to be done to look at the wellness of the pregnancy, and if she's a negative group, for that to be taken into consideration as well.
And there's a pregnancy, it's all going well, she goes home and she just carries on her life, but the doctor thinks that she's had a miscarriage. So
Sure.
What are the next steps?
Okay, so if we know it's a miscarriage, and we know that for sure, then there are a few different possibilities. It may be that the pregnancy ends by itself and comes out by itself, and that can take time, but is certainly nature's way of just emptying the uterus. And some people are happy to wait for that to happen. There are other situations where the bleeding might be very heavy or painful, or the miscarriage has happened a bit later in the first trimester and there's a lot of material from the pregnancy to come out. And in that situation, a curette can be a better thing to do. Little operation to drain the contents of the uterus using suction.
And someone's under general anaesthetic?
Under a general anaesthetic.
Yeah.
And which of those is appropriate is a matter for discussion with the doc based on the clinical scenario and how unwell the woman is and what her preferences are.
Well, everyone, I know that this has been a very heavy topic. It's normal to feel anxious listening to issues around early pregnancy and feeling like, well, what if this happens to me? But if you feel like this anxiety is really causing a change to your daily life and impacting on how happy you feel during your daily life, then I think it's time for you to seek some more help. And first stop is probably the Perinatal Anxiety and Depression Australia website. It's panda.org.au. And they've got a really great mental health checklist, and you can do this checklist just to see whether it's time for you to seek some help. All right, everyone, thank you so much for tuning in to our podcast. We love putting them together for you. If you've really enjoyed this episode or any other episode, please share it with a friend who's either pregnant or thinking of being pregnant. That's how the message gets spread, and that's how more people can be educated just like you. So well done for being informed during your pregnancy.
Thanks for listening, everybody.
Thanks, everybody. Bye for now. Are I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
Want to feel good more often in 2026? Hi, we're here for you. Move by Mamma Mia helps you fit movement into your everyday, giving you more of me time whenever you need it. From strength and cardio to yoga and Pilates, with workout plans that fit every space, every body, and whether you've got 10 minutes or 40. Start 2026 with enjoyable movement from just $9.99 a month. Mamma Mia subscribers get unlimited access. Head to move.mamamia.com.au and use MoveMe to get $20 off an annual subscription.